All right, the meeting is being recorded. So the recording of this meeting and all the recordings of previous meetings will be posted at this website, a2gov.org/rescue funds. And so there's a lot of resources there. And if you haven't already seen videos, which are brief videos of all the projects that gives a little bit of an explainer of each one of them, I do encourage you to go back and look at those. All right, so moving ahead. So to give a technology overview, and I think many people are probably familiar with all of this now that we're 2 years into using Zoom frequently, but at the bottom of the page, there's the raise hand feature. So you can virtually raise your hand and we'll call on you. And then the Q&A feature that's also at the bottom of the page. If you are on the phone, and I actually don't see anybody on the phone, but if you do get booted off and need to rejoin by phone, you can press *9. And you can virtually raise your hand that way and we'll call on you. Now this next item is a demographic poll. So we're doing demographic polls and we've been doing this for all of our meetings or most of our meetings for the past year and a half or so. And this is really to get a sense of who we're reaching so we can get a sense of who we're not reaching. We really do want to do a better job at reaching out to people that we haven't heard from. And this is helping us collect information on who we're not reaching. For that. So I'm going to pause for a moment and launch this poll. And this is optional and anonymous. We really do hope that you take it though, because it does help us out quite a bit. So I'm going to carry on while that poll is open and allow you a few minutes to take that, but I'll just carry on to go over a few other items before we get to the main event. So meeting norms, this is basically a reminder to people that we really want to treat each other respectfully. So we ask you to commit to learning and avoid speculation. Please do ask questions. That's what these sessions are all about. We want you to understand these projects as best as possible. We also ask that when you are speaking over the phone or even over the computer, that you try to move to a quiet space. And I know that this is easier said than done in many circumstances when we have kids and pets and just other things going on around us. But if you can, please do that. That helps us all out. We really do want to hear what you have to say. And then we also ask that you remember the importance of rights and dignity of others. So with that, we ask you to critique ideas, not people. And then to be very thoughtful about your language. We want this to be an inclusive, safe space for everybody to ask questions. All right, so that really brings us to our main show. So I'm going to stop sharing and allow people to ask questions. And I'm going to end this poll in just a moment. I'll give just a few more seconds on that. All right, 3, 2, 1 on the poll. And thank you for those of you who took it. All right, great. Go ahead. Teresa, if you want to begin with your project, please go ahead.
Yes, and I didn't do a slide deck here because I know a lot of folks are familiar. So I'm just going to talk about the expansion of coordinated funding, or the New Human Services Partnership. So many of you are aware this is a partnership between currently the City of Ann Arbor and Washtenaw County. This is a program that actually supports those at or below the poverty line with a number of programs. It is particularly targeted towards the safety net. And recently we're shifting our focus around trying to address issues around poverty, racism, and trauma. It's not that much different than what coordinated funding has been over the last 10 years, in that it's trying to help those that are actually many of the people that were most impacted by COVID, either through actually being more vulnerable of a population, like those who are experiencing homelessness, or those who seniors who are low income, who might have also other pre-existing conditions. So a lot of our vulnerable populations, and this is one of the reasons why it's eligible for the American Rescue Plan funding, which is meant in some ways to address actually still some of the response to COVID and ongoing impacts to those who have suffered from COVID, whether it was directly from being sick or maybe job loss or other impacts. So with the coordinated funding or the new human services partnership, we are looking to add additional funding. So what is being proposed is about $1 million of the city's American Rescue Plan funds that would be added in support of safety net services. Again, that could be in areas around food security, housing and homelessness, senior supports, healthcare, and other areas where we're trying to assist those at or below the poverty line. And even though the city of Ann Arbor is a pretty wealthy community, we do know that there is a number of communities and areas where there's very low income populations that do need ongoing support. So I appreciate your consideration and can field questions as they come up as well.
And then John, if you don't mind doing a brief review of the other project.
Certainly, the Universal Basic Income Pilot, which is a pilot that we proposed as part of the draft memo that went to City Council in the fall. We are proposing to use approximately $2.3 million of ARP funds to put together a 3-year, we called it a UBI pilot, but it's really a guaranteed income pilot. And we would identify 100 families in the city who would receive a subsidy. I think the original proposal was roughly $500 a month over 3 years. And we would also partner with social scientists to help us understand, not just what the impact would be for those families, but what the impact is on our community for providing that kind of aid and really that kind of stimulus for households who may need it. And so, what we know is that there are other organizations in the city that are considering their own universal basic income pilots, and this would be a really good complement for those. So Washtenaw County is considering one, the Ann Arbor Community Foundation also, and all of these different pilots would be targeting different geographic locations or different segments of the population. And so there's an opportunity for us to work together on a really cool combined guaranteed income pilot in the county that could generate support for families in the community that really need it. And direct aid to families is one of the most important priorities of the ARPA funding, but also can help us pilot a really innovative idea that's starting to gain traction nationally and also here in our own community as a way to strengthen our social safety net.
Great, thank you. And I don't see any immediate questions coming up. So for the time being, I'll go back to the presentation too. What I had skipped over is a general overview of ARPA funding. So I will share my screen again and go over that. All right, so what is ARPA funding? So it's basically a government response to the pandemic, more or less a bailout. Ann Arbor received $24.2 million. This program is modeled after a CDBG funding grants. So if you're familiar with that, that's a program that this follows, and that there are federal regulations that stipulate how the funds can be spent. And so this really has some finicky, fine points to it about how the money can be spent. And this next slide gives a overview of the 4 buckets that the money can be spent in. So basically the COVID-19 or negative economic impacts, premium pay for eligible workers, government services to the extent of the loss of revenue, and investment in water, sewer, and broadband infrastructure. Some other important information is that the period that it covers is March of 2021 through December 2024, and that everything must be incurred by December 31st, 2024, and must be spent by December 31st, 2026. And this is a really important point, that the project funding, the projects must be completed by 2026. So this added an extra level of stipulation to the projects that could be chosen, is that they must be completed by 2026. What it can't be used on is pension contributions and debt payments, may not be used as a federal match. There are significant reporting requirements, and that ARPA funds are temporary in nature. So these funds should avoid creating new programs that require an ongoing financial commitment. So how were the projects that you've been learning about this week identified in the two that we're talking about today? One, they meet federal guidelines. Two, they've been reviewed before at some level and received prior council direction. They are projects that can be spent by the 2026 deadline. All right, so that goes the overview. I'm going to stop sharing my screen again and move on to questions. I see that we have a couple that have come in. The first one is, when John, you say Washtenaw County and AAACF are both proposing similar efforts and that your effort could partner, are you suggesting that the same 100 families would get more per month, or that the pilots would include more families?
An excellent question. And I'll answer your second question first, which is, what is my affiliation? And I am the Assistant City Administrator for the City of Ann Arbor. And I was the acting city administrator when the initial ARP recommendation was put together and sent to City Council. So with that being answered, so no, it would not be the same family. The idea, or the same 100 families, the idea is that we would include as many families as possible in the pilot that the city is running, and make sure that we are not essentially double including families across whatever other pilots might be running, but that we're working in partnership with those other pilots so that our efforts are coordinated and that they have the biggest impact on the community.
Thank you. The next one is, are you going to target the disabled for DBI?
So we would, I think the actual allocation of funding is something that deserves a lot of thought. You know, we had a great meeting with mayors for guaranteed income last week, where we talked about the mechanisms that you undertake to make sure that those selected are selected fairly, that they're selected among communities and individual families that could benefit the most from the funding. And so, you know, we would want to have a very intentional process for making sure that people are included equitably and the people are chosen fairly. So I can, that may not seem like a direct answer, but there's a lot of work that goes into determining who's eligible for the funds and who isn't. And what I can say is that households that demonstrate need would be prioritized.
Sure. Thank you. The next one is a clarifying question regarding universal basic income. The city, county, and AACF are considering this project. Will they be using the recovery funds? Will each entity create separate infrastructure to support these projects?
So the cities, I can only speak to the city's pilot, not to the other organizations. We are proposing from the city to use ARP funds. I don't know what source of funds other organizations are proposing, but it would not come from the city's ARP funds. The city would be building its own infrastructure to administer this program. We certainly would be doing so in partnership with organizations in the community, but we would, you know, we would have to build up our own program to administer.
And the next question is about the program requiring ongoing funding. So we said that the funds are not supposed to create new programs that will require ongoing funding after they are over, but isn't that exactly what the universal basic income does?
So yeah, we've pitched this as a 3-year pilot. So this would be a term limited program, and unless other funding came forward, we would not be able to continue it after the ARPA funds were exhausted. Which is, I will note, similar to what many other municipalities are doing too. So this isn't, you know, it is on the one hand an innovative program, but it is also on the other hand a program that has some precedent. There are cities across the country that have done guaranteed income or universal basic income pilots over the last several years and have been able to demonstrate quite a bit of success for the participating families and communities involved, but they have all heretofore been term limited programs.
Thank you. This next question is, will you be soliciting proposals from local nonprofits to spend the coordinated funding dollars? The safety net needs to be much bigger than it has been with the impact of COVID.
Thanks for the question. And yes, we would be doing a funding round. It's one of the requirements with the ARPA dollars. If it's not sole source, then it does go out to bid, but that's been our process for years, that we do funding rounds and put it out for folks to respond. So we would repeat that.
Great. And then this next comment, and I see somebody has a hand up, so I'll get to that in just a moment. So the comment, as you all know, the coordinated funding support has been critically important to helping nonprofit providers in the housing homelessness sector, serving the lowest income and most vulnerable households in Washtenaw County facing homelessness and housing insecurity. Coordinated funding grants have been increased in many years, have not been increased in many years, and many providers have now seen a need to increase staff pay, provide hazard and bonus pay, et cetera, in order to retain existing staff and attract new staff. Additional funding through the coordinated funding process is critically important, and keep in mind that community agencies are essentially doing more with less every year, as they are not regular increases to many federal, state, and local grants. All right. Thank you for that comment. All right, I'm going to jump over to the hand that's raised. Does Ray, please go ahead.
Hello, hello, good afternoon, everyone. My name is Desiree. I have a couple of quick questions. So one is, some of these are around the UBI. So just around how the $500 was kind of come to, and as if as part of the pilot, we'll be looking at whether that's the right amount. And in connection with that, with the other programs, if those are all, if you know that they're, what the amounts are set for those, like if there's any variation in those amounts, that might be part of the coordination maybe. So that was one question. And then the other question I have is around, and I don't know if, well, this is kind of overall in terms of across with all these different projects that the city's put forward, these proposals, and I know that there's going to be a survey that's going to launch at the end of the month. But I'm just wondering in terms of how the selection, like how these different projects will be selected, like what is the weight of decision making, you know, in terms of public participation versus other things when looking across all of the projects, and also whether some projects would not get the full amounts that they're looking for, or things like that. Thank you.
Those are all great questions, Desiree. Thank you. And I'll start with the UBI questions. So the $500 a month was, we modeled it on the UBI pilot that was done in Stockton, California, which is one of the more well-known UBI pilots nationally. Both because of the size and scope of it, and because they were able to demonstrate a lot of success with what they did in Stockton. However, I think that you raise a really great point about variability of benefits. And one of the things that is really important when you're putting together a pilot like this is you need to think about the amount of benefit that you're providing to households, and whether the amount of benefit that you're providing is so great that it can push households out of the eligibility for other types of subsidy that they might qualify for. And so for a lot of different UBI programs, there's like a variability in the benefit depending on somebody's existing circumstances, or it's based on a percentage of expenses or something like that. And so as the details of the program come together, I think it's likely that when we bring on experts, like I said, Mayors for Guaranteed Income. I know I've had several meetings with researchers who live or work in Ann Arbor who engage in this type of research and in these type of programs, who've given us a lot of really great advice and feedback. And the advice that we've gotten is, as we put this program together, we really need to be sensitive to issues like that. And so the benefit levels may change for those purposes. We kind of pegged that $500, knowing that we really can't engage in that really heavy lifting work to build out the program unless we know there's a budget to do that. And so we kind of looked at Stockton, looked at the $500 and pegged that as a budget benchmark for us for this proposal. But I think that I think you raise a great question, that as the program comes together, those types of details might change so that we can, provide the best service for those who are participating in the program. In terms of comparing with benefit levels of other pilots that might get underway in the county, it's definitely something that we'll be talking about if those other pilots get underway. I don't think we have a commitment to necessarily match the benefit level. But I think that what we want to have is a very deliberate conversation about making sure that our various pilots aren't undermining each other. Also, like, we have to be very conscientious about the fact that we need to be doing this in partnership, because for a lot of members of the public who are interested in following the UBI pilot, or maybe even interested in participating about it, they're not going to necessarily sit down and say, well, this one's the city pilot, or this one's that pilot, or this one's that pilot. So we have to really think very conscientiously about being coordinated in that way. And then I think your last question is, what's the actual process for the final decision on how we're spending this money, and what way does the public engagement have? And so today, I think, is the last public engagement session we have scheduled, although there may be more. You should keep your eye out for that. But more importantly, we're launching a survey very soon. All of these sessions have been recorded. They are or will be up on the city website, along with information on the existing recommendation and the various programs that have come along with it. And so we're encouraging people to review all that information, fill out the survey to give us your feedback on what you think should be prioritized. And I can say that absolutely yes, the feedback that we get from the public will be informative in the recommendation that ends up going to council. The recommendation, I'll call it the final draft recommendation of what what we're going to spend the money on, will be put together by the city administrator. That will go to council. They've asked for it by March 1st. And then once it goes to city council, it'll be discussed again in at least one city council meeting. And the council members will have an opportunity to put their own stamp on it, make amendments and make changes before it'll finally be adopted by the city council. And so, I encourage people to participate in the survey, engage with the public engagement tools that we've put out. It does matter. We are listening. Like I said, I'm the assistant city administrator. I put together the first draft recommendation that went to council. I'll be involved in putting together the second one. Marty Prashan is our chief financial officer. She's been in all these public engagement sessions as well. And many of our members of council have been at these engagement sessions also, listening to what people have to say. So participating in this way really does matter. And we're glad that you're here, and we're glad that everybody's here in the meeting.
Thank you. This next question is that we mentioned that there was extensive reporting. What would this look like? Marty, you might be the best one to answer this question. If you don't mind introducing yourself and then sharing information about it.
I can't turn on my camera.
Oh, goodness. Hold on just a moment. There you go.
Good afternoon. I'm Marty Prashan, the city's chief financial officer. The reporting, as with any federal grant, is quite extensive. In this particular case, the city will be required to file quarterly reports until the monies are fully spent and executed. Depending on how the money is spent is dependent on what reporting is required. So in the case of these particular projects, we would have to supply significant data in regards to demographic information. And I'm sure that Teresa is well versed in reporting this type of information. So she is very well prepared to be able to provide the information that we need to report.
Right, thank you. The next question is, will these county managed funds just be able to be used for Ann Arbor residents?
Yeah, thanks for that question. So since coordinated funding's been around for a while, we do have some experience in sort of separating out the different funding sources that are a part of it. So that's one of the pieces that we do, is that the city funds will only go to the nonprofits that are serving city residents. So that's one of the pieces that we're very careful about. And in the case of ARPA funds, they have to, because it's a particular designation for the city of Ann Arbor. So we'll be tracking all that information along with any of the nonprofits who are granted funds. As far as the folks that are using the funding, there's some different percentages of folks that have to be used, but we're very careful of that. And people are actually, a lot of our nonprofit partners that we've worked with for years are pretty great and skilled at tracking that information. So we feel like that's going to be an easy kind of addition. And one of the ways that we can also help support folks impacted by COVID meet the rules of the ARPA funding and that timeline, that looming timeline of when things have to be spent. So that's a kind of a nice way that all fits together with the coordinated funding or the new human services partnership. So thanks for that question.
And this next is a comment. I agree, Amanda Carlisle. Coordinated funding has historically provided crucial support to our rapid rehousing program and supportive housing work within this county. Without this funding, we are having to consider downsizing our efforts in the rapid rehousing realm, which will have a large impact on the county's ability to respond effectively and creatively towards homelessness and housing instability. Additional funding is not only want, but a need. All right, and the next question is, since we have had a coordinated funding process that was working to keep a constant stream of funding for providers, doesn't it make sense to use the ARPA money to reinstate this viable program rather than test a new one?
Definitely, I think that would be an easy way to distribute the funds. But yeah, so I appreciate that. It would be, the process is in place. It's basically just kind of continuing what we've done historically, but additional funds going into it to support folks impacted by COVID.
Thanks, Teresa. This next question, of all the projects to be funded with ARPA funds, how much money would it cost for all the projects to be funded?
So all the projects proposed to date, I think it's $52 million. And like I said, we have $24.2 million. So we have some tough decisions to make in terms of what's actually going to get funded and what's not.
Thank you. This is another funny question. Curious about how the 24 million was divvied up by the projects. For example, 6 million for a fire station, but only 4.5 for basic human needs.
Well, I'll take that. So we didn't propose $6 million for a fire station. And I think that what we did was we looked at the federal guidelines and what is encouraged for the federal funds to be spent on, which, your very top line analysis is that it's impacts from the COVID-19 pandemic. As you dive deeper into the federal regulations, though, it's very clear that the federal government is encouraging municipalities to think very broadly about what that means. So that's not just support for nonprofit services, and it's not just support for things like affordable housing, but they also encourage municipalities to invest in things like energy efficiency. They encourage municipalities to think about emergency response and emergency preparedness. And so everything that we have included in the proposal are things that are not just allowed under the federal regulations, but in many instances specifically encouraged by the federal regulations. And all of the projects I think with the exception of the UBI pilot, every single project is one that enjoyed some very specific endorsement from the city council. I will say it's general endorsement from the city council, not specific endorsement. So for instance, when we looked at things like solar on city facilities, the city council has asked the staff to make the city carbon neutral by a set date. And so we're, consider that a strategic priority of the city. And it's certainly something that that we've heard loudly from the community that they want us to prioritize. When we think about, investing in affordable housing, there's been many resolutions passed by our city council directing staff to prioritize funding for affordable housing. So that's really what we looked at when we put the recommendation together. And if you have questions about, what specific parts of the federal regulations or specific resolutions were used to come to the recommendation, there's a memo on the project website that was communicated to council in the fall that details all of that specifically. So you can go through all the city papers and actions and everything that led to the prioritization that was provided.
Thank you. All right, this next question is, the county's new human service partnership aims to address poverty, racism, and trauma. Avalon runs a syringe access site, moves people into housing directly out of chronic homelessness, provides 24/7 on-site services that mediate conflict, addiction, behavioral health issues, eviction, child welfare involvement, and more, for instance, trauma. And all of this is at the intersection of poverty and racism. We fully support a focus on these priority areas and want to see the human services funding partnership support continuing investments in high impact long-term solutions. So that was more of a comment. Thank you for that. The next question is it known that the safety net providers be defined under the new funding model? Is it known how the safety net providers be defined under the new funding model?
So we have not finalized the language. I'm not sure if that was me. We haven't finalized how they're being defined, but what's been proposed to date has been emergency food access, housing and homelessness, access to healthcare, childcare as well. So those have been kind of the general 4 areas, but as I mentioned, it hasn't been finalized. There's actually a group of 4 meetings coming up in January and February with the city and the county leadership, where we're going to be pinning down a lot of these definitions and kind of final touches of the framework for the new human services partnership. So we should be able to have all that information kind of lined up if this were to proceed with the ARPA funds. I know the timeline is, I think it's decisions in March or April. So the timing would flow very well with where we are with the planning for the new human services partnership. If I messed up that timeline, John, Marty, please correct me. I don't know if I have that quite right.
All right, this next one is another funding question. How did you decide on the 1 million for the coordinated funding proposal?
We knew we wanted to support coordinated funding. We had to balance a lot of different priorities. And so, we pegged in $1 million, but I think it's important for people to keep in mind that this is a draft proposal. And if the feedback we receive from the community and from city council is that that funding should be increased or decreased, we're going to react to that. And the final adoption of the plan will reflect those sentiments. So again, I encourage everybody, fill out the survey. Engage in all the engagement activities that we have thus far and that may be forthcoming, and make sure that you communicate with council members too, because there's a long way to go before we come to a final recommendation on how these funds are spent.
And John, just to clarify, all of those amounts, I believe, are one time. It's not like it's an annual contribution, right? The numbers are. Okay.
That's right.
Just to clarify that too. Thanks.
Okay, I don't see any hands raised at the moment and no questions in the Q&A. Teresa or John, is there anything else that you wanted to add about either of these projects?
Just thanks for all those folks that are attending. I see a lot of familiar names. I'm glad you came out to ask questions and support these efforts. So thanks everybody for showing up.
And we do have another question that came in. Would residents be able to see the federal government's advisement or guidance on using the ARPA funds?
Yep, all the federal guidelines are public. The interim rule was made public, I think, in April, right, Marty? And the final rule was just published, so all that is available. It's been in the public record for almost a year, so you can feel free to head over to the Federal Registry and have a read through it. It's actually it's written as a narrative, so it's not as mind-numbing as you might think it would be for a federal regulation. Several of us have read it cover to cover and have dog-eared highlighted copies sitting on our desk, and so it actually is a fairly accessible document.
Thank you. All right, this next question is for Teresa regarding Human Service Partnership. Did I hear you say that those funds, basic needs, will be in the 4 buckets of food, housing, childcare, and health? This seems limited.
So hopefully you also heard that they have not been finalized, but those were the 4 buckets that I did mention. So emergency food access, housing and homelessness, childcare, and access to healthcare. But again, that's not finalized. So, and I do appreciate that that does not cover the entirety of the safety net. So thank you for that comment. I do appreciate that.
All right, we've got a hand raised. Councilmember Song.
Hi, I just want to note that the county has already allocated their first tranche of ARPA funding, or the County Board of Commissioners had voted on that earlier in the fall. So maybe if I could have staff maybe speak a little bit to how the next tranche is going to be planned, what the community engagement would be like, if you have any kind of a heads up on that, and if there's a sense of maybe coordinating efforts with city and county.
So I can talk about the tranches with this, right? The 24.2 million is the entire amount that we would receive from the federal government. It is both of our tranches together. And for people who aren't familiar with what the tranche indicates, the actual bill passed by Congress used the word tranche to indicate that the money will be split in half. And we got half of it in the summer of 2021, and we're going to get the other half of it in 2022. But 24.2 million is our full amount. And so this is the engagement for the whole kit and caboodle for what the city of Ann Arbor is going to be getting. And in terms of work with the county, we had some discussions with the county about coordinating allocations, but the needs of the city and the county government, you'd think we're both local governments and we do essentially the same thing. But the truth is that city governments and county governments really have very different missions. And so, we had some discussions with the county, but ultimately we recommended our own separate funding plan, with the exception, of course, with funding for coordinated funders, which is something we do jointly with the county on the regular anyway, and then opportunities to collaborate individually on things like the Universal Basic Income Pilot or other projects. There will be some opportunity for work there.
Councilmember Song, were you asking about the community process for the county too, or were you just talking about the city?
The county too. I mean, I participated in the town halls for the county, and I called in for public comments for the county. And I'm just wondering if we have a sense of when the next, because the county's already allocated the first half of the 70 million. That was 35, right? So I'm wondering, is that wrong?
It's actually a little bit less than that. They use some general fund to substitute. So it's the first round did get allocated. The second round is going to be considered at the next 2 county board meetings. There's a couple of proposals that are up related to healthcare, a mobile support unit that could go around the county and deliver services, as well as another kind of grant funding round that's specifically to COVID response. Some of that's violence prevention, homelessness again, and a few other areas, particularly targeted on the east side. And then there'll be at least one other tranche, just to use that word, because keep it going, right, John? And that's expected later in the spring, and there'll probably be additional community sessions prior to that one. But for the next round, it's actually under discussion at the next 2 county meetings in February. So it's a great time to participate there. Trying not to confuse all of it, but a lot going on with the ARPA funds.
Thank you. I just want to make one last comment on how crucial I think this funding is to help our community members recover from the pandemic, and that we've seen the child tax credit expire, and we've seen with we've had government some different programs expire over, like the what was it? The eviction moratorium had expired last fall. Now the child tax credit is expiring. And so where we assume there'd be assistance, it's just kind of falling by the wayside. And my worry is that, we should also be advocating on the state with state reps too, because there's still pandemic related recovery money that hasn't been allocated, right? So it's not just the city and the county that needs to be working in recovery. There's also the state, and also pressing, I guess, our federal reps as best as we can. All right, thank you.
Yeah, thank you. And this next question is, when John talked about city council support for the projects, he said all except for universal basic income. Why is that?
Good, very good question. And that is for a very important reason. And that is that if you look at the memo that's provided on the project website, where it cites, like, this is the part of the federal regulation, and this is the city council support, historical city council support for, generally policies like this. We have, I went through and when we were putting the recommendation together, really went through and looked at prior specific city council resolutions that say things like, build more affordable housing, or please get this net zero fire station done, or we're going to endorse Vision Zero and we want the city to make that a priority. There isn't one of those from city council historically, because universal basic income pilots are really kind of a new thing on the municipal scene. They've really only started cropping up in the last couple of years. So there isn't that prior specific direction from city council body. But there's something else we looked at when we were prioritizing these projects too, and that is the priority matrix that we use for our priority-based budgeting model. And that's a document that really outlines the values that staff should be prioritizing in the budget as we prepare that budget document every year. And there is, I would say, there is some general direction within the priority matrix for something like a universal basic income pilot, because we're directed to prioritize expenditures that help meet the service needs and the basic human needs of impoverished and disenfranchised residents to maximize their health and their well-being. Now, I understand the idea of a universal basic income is that everybody gets some kind of a subsidy, but because of the limited nature of this program, it really is more of a guaranteed income pilot. And because of the limitations of the ARPA funding eligibility, we would really want to make sure that it's targeted at households that have a true economic need. And so that's why I mentioned that, is every other project has some kind of specific, I keep using the word specific, either a specific or a very general policy endorsement through a specific resolution from the council, but the universal basic income pilot doesn't, because it's such a new concept.
Thank you. All right. I don't see any hands raised or questions in the Q&A. All right, well then I will go to the slide that talks about the process a little bit more, and what's to come next. If you do have questions, please, that come to you as I'm talking about that, please do go ahead and put them in the Q&A or raise your hand. But for the moment, I'll talk about that. I'll just jump down to the slide. Okay, so this, oops, sorry. This slide shows the the pathway to the decision-making process. So this all started back in the fall where projects were identified. So that's been talked about a little bit already. So it was this preliminary list of projects that met the criteria, funding, and that met our, projects that had already been identified as city priorities. And so that went on into December and January where that was refined a little bit more. And now we're sharing that out with the community. So this is the list of projects that we're putting out there for consideration, and having these series of community conversations about them so that the community can learn about them. And from there, we will be conducting the survey, which was mentioned earlier. So that's going to be coming out by the end of this month. And that survey will be an online survey as well as a paper survey. And it'll be asking basically the question of where would you spend the money? What are the projects that you would prioritize? And so we'll be compiling all of that information, all of that feedback, and the comments that we've received from these meetings and sharing that with council. And so that all goes to council in March, where a decision will be made about the projects. Once that's decided, we'll start implementing the project. And as was mentioned before, the projects do need to be done by 2026. So the work will begin as soon as possible in 2022 and go through 2026. And then I do want to show this slide as well. These are our meetings. We've basically gone through all of these meetings. Today is the last one, but if there's one on here that you weren't able to catch, please do go to this website that's listed at the bottom of the page where you can see a recording of the meeting. And I do see that another question came in, so I will stop share and go to this question. Is the survey only going to Ann Arbor residents, or will it go out to people who also work but not live in Ann Arbor? So this will go out broadly. So it'll be disseminated through all the sources that we have. So it'll go out through social media. It will go out through our email system that we have. We may try to do flyers again. We're actually finding that good old flyers are actually a pretty good way of reaching people. So we're going to try to get it out far and wide. So really anybody who receives notice of it would be able to respond to the survey. Any other questions?
Heather, you have to tell me your flyering techniques later. I would love to hear what's been working.
Yeah, we're trying out many different things. Yeah, I'll let you know. All right, well, we'll hang out for a few more minutes. I don't see any other questions coming in, but this was scheduled to go till 5 or 5:30. But in any case, we do have a little bit more time. So we'll just wait a little bit longer in case any questions come to anybody. We'd be happy to answer them. In the meantime, I'll go ahead and I'll post that last slide back up there so you can look at the project website. So there it is at the bottom. So if you do want to check out the recordings or find out information or keep updated, there's also a feature on this website where you can sign up for updates. So if you do want to submit your email to that, then we'll be sending out emails through that. So that's one way you would get the survey. So please do sign up if you'd like to. In the meantime, thank you everybody for attending these. I see on the list of people that several of you have attended some of the sessions that I've been in, some of the same meetings. So you've been with us all week long, and I do appreciate that. I know it's a lot of time to spend learning about these projects, and we do appreciate that you're engaging in this and doing your effort to understand what the projects are. And we hope to hear from you on the survey. Another question came in. Do we have a sense of how the townships are spending their ARPA funds? I see Superior Township is considering dedicating it to particular neighborhoods. Where are others in the county in the decision-making process?
I know about the Superior Township one as well, but they have decided to commit it to the MacArthur neighborhood. I know Ypsi Township is looking to put together a process. I don't think that's been announced yet. And I have not heard from some of the other ones. The allocations do get smaller. You know, it's the formula, Heather had mentioned, it's based on that community development block grant one, which is based on population, low income population and housing problems. So it really will vary depending on the community, how much is received. So the biggest allocations, obviously the county, the city of Ann Arbor, then followed by Ypsi Township. Those are the top three.
Thanks, Teresa. Another question came in. In the 4 buckets for human services, are you assuming that support for senior services could fit into those? Or is there consideration to add a separate bucket?
Absolutely see seniors fitting in all of those things. So not would be included in all those areas rather than maybe a separate one. Yes.
Thank you. And I do see that Councilmember Griswold joined us. Another question is it possible to ask for a majority of the funds to be spent on social services and not infrastructure, especially if federal infrastructure funding comes through?
It is definitely possible to ask, and that kind of feedback is exactly what we're wanting to hear in the public engagement process. So, yeah, but you should fill out the survey and definitely indicate that on your survey.
And Councilmember Song, I see your hand is raised. All right, you should be able to go ahead.
Can we anticipate additional community engagement sessions besides the ones that were already listed on the website, and whether those would be different from what we've done so far?
Yeah, I think that's to be determined. It's something that we're discussing. And I think what we've tried to do is structure these so that there was an introductory engagement session, and then we had an opportunity to kind of go into detail on each project. If we scheduled a session in the future, we would want to make that more of kind of a concluding session where people can come and give their general thoughts after they've seen these meetings and reviewed documents. What kind of verbal feedback would people want to give us on the entire matrix of the recommendation? So that kind of a meeting may be forthcoming, and if it does, it will be well publicized.
Great, thank you.
The next question is, I know this is not a human services partnership discussion, but it seems to me that the basic needs buckets doesn't exactly jibe with the emphasis on poverty, racism, and trauma. Can you speak to that?
I actually love that question. So thanks for bringing it up. The new human services partnership has 3 main funding areas. Where we think the ARPA funds would fit is in one particular area, the safety net services. And the thought is to maintain the safety net, but then also invest in basically high impact grants, which would be we'd be looking to really scale existing programs or complementary programs so we can either go deeper or more broadly to serve people and address those issues around poverty, racism, and trauma. And there's actually another area of funding, which is a little bit more around mini grants, where we want to be a little more high risk and actually try things out to see what works. So if someone has a great idea, we've never tried it, let's invest in it and see what progress we could make. And that could potentially move into a high impact investment, for example. So the idea is that they would all work in concert towards those goals, towards addressing poverty, racism, and trauma. But we don't want to necessarily remove the safety net funding to move into those areas. We want to sustain that and then also invest in the other areas as well. It's a short version of it, but hopefully that will get to your question.
Thanks, Teresa. And then this next question is, I missed where to take the survey. Could you please let us know again? So the survey isn't actually up yet. We did want to, and I'll show you the website where it will be posted. In addition, we'll be getting the word out and sharing broadly where you can find the survey. But we wanted to wait to put the survey out until after we got through all these sessions, just kind of for fairness for all of the projects. These sessions are meant to be informational so that people had a fuller understanding of what the projects are so they can make a more informed decision about where you would want the money spent. So that's why it's not out yet, but that will be coming. And I will share my screen again so you can see where that website is. So you can see that at the bottom of the page, a2gov.org/rescue funds. And I see that Teresa typed that into the Q&A. So thank you, Teresa. Appreciate that. And I see that someone has their hands up. Glenn, go ahead.
Sorry, I'm late. I had another meeting and I just got here, so I have no idea what's happened up to this point. So I'll be brief just to get my 2 cents worth in. I'm a strong supporter of the coordinated funding, and I hope that that is a healthy portion of the package with the ARPA funds. In my view, it's not only important in its current help to people, it fits my values, it fits a lot of people's values. It's also an investment that I think the first tier of prevention and treatment of things like mental health issues is reducing stress. Stress is not good for the brain. It can put people over the edge who are near to having a mental health condition, and it can make it worse in people that do. So the first tier of a good community mental health program is good services. So I'm a strong supporter of coordinated funding, very thankful to all of you, Teresa, who managed that program, and to the city of Ann Arbor for being a contributor, a major contributor. The second point I want to make is that on basic income support, it's an idea that is very appealing. My first job in Washington, D.C. back in the early 1970s was with the Office of Economic Opportunity, and particularly with the rural dimension of programs. And we ran experiments on direct cash subsidies to families, and it was very important. My concern with us doing it here in Washtenaw County in the city of Ann Arbor is what would be the percentage of funds that would have to go to professionals, either the staff in the city or staff outside the city. And it seems to me, based on my experience, to do that program well takes a strong staff backup. And I'm concerned that at the end of the experiment, when we looked at it, we would find that a very large chunk of the money went to people who are not poor, but earning incomes of 45,000 and above. And I think we can get a bigger bang for, well, what I would want to know is for it to be displayed, if it stays in the package, how much is going to people who are in need and how much is going to professionals who could find jobs elsewhere and don't fit our picture of need. And then that would answer the question of, is it, what's the bang for the buck in terms of the target population? If my hypothesis is correct, that with a new startup program and with the monitoring that's required, the proportion going to professionals is relatively high. I would be in favor of funding other things, but I do want to go back to where I started. It's not because I'm opposed to helping people who need help, especially in this climate. It's a question of how to get the most services to them to improve their lives as much as possible. So those are the 2 points. Thank you for letting me raise my hand and probably completely out of context say something. And thanks to all of you for all you're doing.
Thank you, Glenn. And somebody else in the group says, Glenn Nelson, thank you for participating, taking your time and voicing your valid concerns. The previous speaker makes a good point. This is something that came in the Q&A. The previous speaker makes a good point about the efficacy of having 3 separate entities doing the same pilot.
I will just note for the county pilot, we are looking at sort of a particular area of the county, sort of more of a place-based or neighborhood approach. It's not funded yet, so it's really, we're not even talking about it very much publicly because it's very much in the conceptual stages. Like John said, I think a lot of these are sort of really starting up just about the same time, and I imagine we'll be talking more about them, but I do think that they would be different enough that we would not be overlapping and also be looking into sort of testing out different ideas on how something like that could have an impact. So, but I appreciate that. And I definitely think it's of mind if these things are happening, how are we going to make sure they're coordinated and they're not duplicating things, they're distinct and they're useful, right? That they're actually having an impact. So I do really appreciate the folks that brought that up.
And I'll add to that, the other universal basic income pilot that I'm aware of in the county is probably going to be focused on rural poverty. And so, that's something else to keep in mind too, is that while all of these are ostensibly UBI pilots, either in concept or in practice, they really are focused on looking at poverty from different angles and different ways. And so I wouldn't want people to think, well, if there's already a UBI pilot going on in the county, why would the city do one? Well, it's because it's a good way to provide direct data households within the city limits, and it's a kind of looking at poverty from a different angle than I think the other UBI pilots would be. So, and the other thing is, having multiple pilots going on at the same time also creates opportunity for people to share resources and to have colleagues just in arm's length away who can help you troubleshoot problems. It also creates an opportunity to share administrative resources and find economies of scale to lower costs on the administrative side. So, all of these pilots are inchoate and young and still very conceptual, but if all of them came together, I think it could be something really tremendous for the greater Ann Arbor and greater Washtenaw County community.
And this person writes, I love the idea of the UBI. I think it would be a waste of funds to create 3 separate staffing infrastructure to do it. Why not have the same entity administer 3 universal basic income projects?
Why not?
Could definitely happen. I think government has a little bit of overhead, so it's possible it might all go through one separate entity that may or may not even be government. So lots to figure out, but I support that.
Yeah.
I don't see any other hands raised or questions coming in. Once again, we'll wait a few more minutes. This is scheduled to go to 5:30, so we do have a little bit of time to see if any questions come to anybody. So we'll hang out here for a moment or two. Councilmember Song.
Hi, could we get a little bit of an overview of the poverty rate within Ann Arbor? The one thing that I've heard over the years repeated is that, we have, I think, 1 in 4 kids at below poverty level within the city and townships within the Ann Arbor Public School District lines. Do we have a sense of if that's changed during the pandemic? And I'm just trying to get a sense of like the increased needs and if we have a sense of numbers on families or children.
Yeah, I don't think that we have that data currently. It's hard to get it very quickly. I was actually looking up unemployment rates randomly recently, and obviously those only go through November. Those we can get countywide. Something as usually poverty rates do lag, their childhood poverty rates can lag 6 months to a year, and that's kind of counting on state or census data. So I don't know that we have that. We do have a lot of partners on the call. So if I'm wrong and somebody else and our attendees has that information, please feel free to share that.
I know just because I was looking at it earlier today, I can tell you that the 2020 census figure for Ann Arbor is it's 22.3% of households are below the federal poverty line. I know that the federal poverty line can sometimes not be the best measure for poverty, but it's what we got. So I know that figure is what was reported in the census. But to Teresa's point, those numbers fluctuate, especially with the way the pandemic has kind of thrown everything on its head. I don't know how those numbers would be updated for January 2022.
John, did you happen to catch childhood poverty for Ann Arbor by chance? Okay.
No.
It's okay. No pressure.
And that number is for the city, John, not the county, the 22.3%. Yeah.
Okay, so I guess our more immediate, we can access more immediately the numbers like of poverty or need by service requests. Then maybe that's where our agencies can kind of give us feedback on the level of food insecurity, housing insecurity. So maybe that's more local data that's more readily accessible.
Glenn Nelson has his hands up. You can go ahead if you have more information.
Um,
Please go ahead and share.
I would, I think it's a very good, interesting question. One possible avenue, and I'm certainly not saying it would answer it, but a possible avenue is to look at the food distribution programs of the public schools over this period, because they would have things like the number of meals served, perhaps by week or by month. And since these programs evolved, I realized that would be the changes in family well-being would be intermingled with awareness of the program, how was it publicized, and that sort of thing. But it might give some indication of numbers of families with food insecurity and whether it's changed over the course of the pandemic.
Thank you. All right, something else came in. It has, and we are happy to share this with OCED. Thank you, Eileen. All right, any other questions? Comments, thoughts? All right, once again, we'll wait a few more minutes. It's almost quarter after. We'll wait until at least 5:15 to see if anything comes to anyone. But in the meantime, once again, thank you everyone for attending these meetings and asking your thoughtful questions. Thank you, Glenn. We received a thank you from him. We appreciate that.
Glenn has been one of the most consistent attendees and commenters at these public engagement sessions. So thank you, Glenn, for your attendance and your consistently constructive comments.
Agreed. This next question is, can we get a roll call of social service agencies here to see if community engagement is reaching the sector? Actually, a lot of people have dropped off. We were up to, I think, 25 people here earlier. Now we're down to 9. But Teresa, do you happen to remember? I know that Amanda Carlisle was here. Who else did you notice was here?
Well, Eileen from Food Gatherers, you saw. Tish Lee is from Legal Services. Sarah Thornburg from Friends Indeed. Earlier, there were folks from Avalon on the call. And I looked and I didn't write them down though, so I'm missing folks. I think I saw Bonnie Billups from Peace Neighborhood. He's still on there. Yes, hi. I missed some others, so sorry. There was quite a few housing agencies and a few other senior providers, I think, as well. So sorry I didn't catch them all and write them down, but there was, I want to say there was probably between 15 and 20 folks representing social service agencies.
All right, we'll give it about 1 or 2 more minutes. Thank you. Thank you from Lynn Song came in. We appreciate that. All right, well, I think we'll call it for today. Again, thank you for all of those who attended and those of you who stayed until the very end. We really appreciate you sticking with us. And again, I know a number of you have been with us all week, so we do appreciate you engaging. And another thank you came in. You're welcome. We appreciate that. Again, these are all going to be posted up on the website, so I encourage you to go back. If you missed anything, please go back and review the videos, both of the projects themselves and of the meetings, and look for the survey that will be coming out soon. All right, and with that, thank you, everyone.
Thank you. Have a good night.
Thank you.